Dr. Mir-Salim, what's your personal opinion about this combination therapy?
I think this combination therapy is a very good way to treat it. We know nowadays that there are different ways, and of course a lot of different ways to treat tinnitus, but this is a very good method.
Yeah. So it is very difficult to treat tinnitus, especially when it becomes chronic. Why is it that it's very difficult for chronic diseases to be treated?
You have to imagine that a chronic disease always give us some problems concerning treatment because it's so long-lasting. So to go into this process and to break it down, to find new ways for the patient is a hard way.
Mm. I really remember a patient of mine in my surgery, and this was a female, and she was suffering from tinnitus for about, I think, 4 or 5 years. And after those 5 years, the tinnitus wasn't just there. And she came into my office and said, my tinnitus is gone. And she was very afraid and said, I'm missing the tinnitus. I'm very used to it. Now it's all silence here. Is it a typical patient?
Yeah, it's not really a typical patient. If you have this case, so that somebody is coming into your practice and talking about, I would like to have my tinnitus back, this is absolutely rare. The normal patient has these kind of symptoms, and it's going down just like a fever curve, going up and down the complaint. So this is more typical about that.
But treatment is not all about coping mechanism. So if patients cope with tinnitus better, is there a better chance of healing? Like if they say, I'm better used to it and it doesn't bother me at all, the tinnitus. So some patients are bothered and others say, I don't care at all.
The best way is just to just ignore it.
Okay.
This is the best way of treatment.
That's the best way of treatment.
Yeah, sure.
And what's your personal approach when it comes to chronic tinnitus?
So my personal approach is just to try to talk with the patient, counseling, and to investigate different things, to talk to the patient that there's nothing severe behind these symptoms.
Okay. And there are some modern devices you can put inside the ear. They're making noises, like a hearing aid. Do you use them?
So a hearing aid is indicated if you have a hearing loss. So then it's, of course, a good way to treat it. And there's another way, I think what you mean are tinnitus maskers. Yeah. These are able to just, to cover the sound, to get it behind in life, so don't think about that. But this is only working during day when the patients are wearing these devices.
Okay, and should they wear it overnight as well?
It's possible, but most of the people doesn't do that.
Because they sleep?
Yeah.
Okay.
That's right.
So what do you personally think about alternative complementary treatments like acupuncture treatment?
I think there are, of course, some different ways, but what we are talking usually about, that's something like magnetic therapies or soft laser methods. This is really not evidence-based.
Okay. So one thing could be just to make some sounds inside the ear, like in this device. And our viewer, Brianna La Camero from Uruguay, wanted to know, should you rest your ears, go to a silent place in nature, for instance, to get rid of the tinnitus?
Yeah, this is usually not the best way to treat it. If it's just quiet outside, if you're looking for such a situation, then the complaints are coming more up. So just behave like always and try to be in your life as always.
Okay. So as an ENT doctor, are there any special or secret tips you would advise me?
I think a very good way would be a relaxation therapy if you try this, or if you have a problem with the hearing, just avoid noises, loud noises.
Okay. And you can even do this before it comes to tinnitus. Dr. Mir-Salim, thank you so much for being with us in the studio. Thank you.